Hi, I'm Dr. Roadhouse, and I want to introduce you to one of our chiropractic patients, Jim French. Jim, why don't you talk about the symptoms that you had that brought you into our office?
Well, there were many, but I was down in the back really bad. I had lifted something apparently the wrong way, and it went into my back real bad. I couldn't lay down good at night. I couldn't walk standing straight up. I couldn't bend. I couldn't do anything. It was just real painful, and it even went down into my upper leg. Worst pain I've ever had in my life.
And so we had this for a while, it wasn't responding, and then who referred you to our office?
Well,
Our doctor.
after over a week of this, I had to go see my dermatologist, and was telling him about it, and he recommended Dr. Roadhouse. He said he did his wife a really good service. No, it was himself. In fact,
Right.
he did a good service for her. So I looked him up and came up and started treating with him.
Okay, so we started just after we evaluated your case, we found that you had a couple of misalignments and pretty bad pinched nerve. So we started with regular chiropractic treatments and just nice gentle adjustments, and then just talk about how you've done since then.
Well, since then, it's been marvelous. But I have to say that during the treatments, some days I'd come in and the gals that worked for you could tell that I was just really in pain and agony because it was in my eyes. I was just showing everywhere. And sometimes I didn't leave feeling much better, but that's chiropractic business. But I knew that Dr. Roadhouse was on the right track, and many times though, when I came in, I'd feel bad after I had the treatment. I'd leave. By the time I got to breakfast, I was feeling a lot better, a lot better.
Yeah, in the beginning, when it's that there's so much pain involved, there's so much swelling and inflammation. You can't expect to come in and get better right away. I mean, if someone dislocates their finger and someone immediately puts it back in, it still goes through an inflammatory phase. It still swells. It still hurts for quite some time. In the finger, we don't have a spinal cord and nerves involved. So it was a difficult case. It did take some time, but you got complete resolution of your symptoms, right?
Yes, I did. I'm glad you mentioned that because I do want to say to all of your patients that this is not an overnight cure for anybody. I didn't think that I was ever going to get over it, but man, all of a sudden it started getting better every week, and all of a sudden I was feeling great even when I came in.
So what we did after he did better is we started strengthening the area. And as a matter of fact, it's been quite some time. How long ago was it that I treated you? Remember?
It's been at least 2 or 3 years since I was in. I haven't had a symptom or any redevelopment of that since.
Yeah.
It's been all cured up.
And you haven't had any treatments with me since then.
Mm-hmm.
And the only reason you're here is because
Yeah, I had such great results with Dr. Roadhouse that my wife started having these hip pains, which she had for several years. And I just decided one day, why don't you try calling Dr. Roadhouse and let's see if we can't get him to take a look at you and see what he thinks is wrong. And we came in, and that's the only reason I'm in here now is because I got her in, and she's been seeing him now for probably about 6, 8 weeks, and she's getting better all right along.
and she had hip pain going down her legs. Well, that's another story. We'll talk about
Yeah.
that. So the only reason you're here is because you're riding shotgun with her, for her
Yeah.
appointments and stuff, and
That's right.
keeping her company. And then you saw that we'd been doing some videos on some other patients, and you volunteered to do it. And I think it's really good that, number one, you have a really tough case, but the other thing is, after we were done with you, you were done. You haven't needed any other treatments. Everything's been good, and you referred your wife in. So I'm glad that you had such good results with this, and now your wife is getting good results. And I'm glad you did this video for us because there's a lot of patients that may not know that chiropractic could be the answer to their problem, and I'm glad that that you shared your situation with us.
I'm glad. I was very happy to do it. I just want to reiterate one more time and tell all your patients to be patient. That it's not an overnight cure, but I'm telling you that it'll work. This guy's great. He's really great.
Okay. Well, thank you very much, Jim. I appreciate you doing the
My
video.
pleasure.
Thank
My
you.
pleasure.